Thank you so much, John, for inviting me to talk about this book, which wouldn't have been possible without so many birth workers and Black feminist scholars and reproductive justice leaders and thinkers. And I'm coming to you from Ho Chunk land, currently called Madison, Wisconsin, and I am an associate professor of gender and women's studies at the University of Wisconsin-Madison, and I'm a former midwife.
Well, thank you for joining us. The book we are talking about is Fatal Denial, Racism in the Political Life of Black Infant Mortality. So, as you kind of alluded to earlier, there it is, how did you find yourself writing this book? And was there anything that you learned in the composition of it in the research that really stood out to you?
Yeah, I mean, it was a real process. My midwifery background was actually central to this process. So in I was licensed as a midwife, started apprenticing in 2000, and I was licensed from 2003 to 2015. And though I wasn't practicing for most of that time, I actually trained for longer than I apprenticed. I maintained my membership in national and state midwifery organizations. Through really the generous sharing of critique and experiences of racism by midwives of color and Black midwives in particular in these organizations, they taught me how midwifery, which in the United States is not, fully integrated into the healthcare system. I mean, there are nurse midwives who work in hospitals, but I was trained as a home birth midwife, and that was founded as a kind of radical reclamation of birthways that, as I track in the book, had been, repressed, smeared as backward and anachronistic. And this happened in different ways for Indigenous midwives and Black midwives and European immigrant midwives and Latine, Mexican American midwives in the Southwest, Japanese American midwives, so it had different geographies. But, by the mid 20th century, most births were attended by midwives in the late 19th century and into the 20th, early 20th. And then by the mid 20th century, that number had really decreased. And it was a product of a deliberate, anti-midwife campaign by the American Medical Association and other health authorities. And so I learned this, midwives of color taught me this history. And then also, scholars like Gertrude Fraser, who wrote an incredible book, African American Midwifery in the South. I just started understanding what I had come to as a kind of, thinking about it as a really radical feminist movement and site of praxis that really embraced the whole person and was universally relevant. I saw that like the rest of our society, it was riven with anti-Black racism, other forms of racism, and the ways that those are also intertwined with misogyny, kind of in complex ways, and kind of like upholding of heteropatriarchy, and also, of course, settler colonialism. And in 2012, there had been these kind of culminating or these dialogues in which over like I'd say from like 2009, probably more longstanding, but really coming out in kind of the 2000s, 2010, 11, 12, in which midwives of color were increasingly saying midwifery, as it serves birthing people, it cannot be what it needs to be without reckoning with the racism inside of the institutions and educational curricula. And I was able to, as I hadn't when I kind of entered into the practice, I was also able to witness the ways that white midwives were declaring their innocence, really, defensive and not able or willing to listen to this really generous offering of like, if we want these organizations to really serve all birthing people, then you know, you need to change. These organizations need to change. And so in 2012, there was a group of midwives of color, um, uh, primarily Black midwives, but also some other midwives of color who left the national organization, the Midwives Association of North America. And that was a pivotal moment for me. I learned so much and really wanted to work with um, both work with a range of midwives who are committed to transforming these organizations and the way and the education. And so I'll actually read a little bit of kind of what I realized later was a seed of this project, even though it hadn't, like I hadn't really envisioned the whole thing yet. And so um so there was a 2012 letter of resignation from this national midwifery organization after decades of institutional racism and really egregious tokenizations and erasures of Black midwifery history, Indigenous midwifery history. And in that letter, this group of leading midwives of color, Black midwives in particular, they foregrounded the kind of everyday violence of preventable Black infant mortality as something that white midwives were like not even addressing at all. And so in that document, that really stood out to me as uh, kind of one of the primary sites at which white midwifery was really kind of concertedly refusing to like comprehend what pregnancy and birth was like for all birthing people and Black birthing people in particular in the United States, and to shift into real, to attending to that reality. And then I was also at the time in my graduate career, I was reading, James Baldwin on racial innocence, and it just like kind of came together for me. And so that defensiveness of white midwifery, the whitewashing, as I was talking about these histories, appropriation of indigenous birthways. And so a group that formed that I was part of in the wake of that resignation, Anti-Racism and Anti-Oppression in Midwifery, wrote a statement that included these words. Quote, white midwives' failure to acknowledge this history while laying claim to traditional knowledge from the 1970s onward is an act of violence, erasing midwives of color from the past and creating an innocent present for white dominant midwifery. So again, like I was kind of seeing these two worlds as separate at the time, but it really planted seeds for me. And yeah, and then it really took me a long time so I wrote the dissertation and as I kind of came to understand, through readers who were offering me really important critiques, um, I really grappled for a long time with how to write a book about Black infant mortality as a white scholar. And what I came to was that, there is this long lineage, which I track, starting with Frederick Hoffman in the 1890s, a German-born white statistician who really used infant mortality statistics to quote unquote prove, um, the like racial degeneracy and in fact more abundity, like kind of a fated disappearance of Black people. that was kind of one of his primary anchor points in this text that I discussed in chapter one, the race traits and tendencies of the American Negro, which then W.E.B. Du Bois and others really critique. Um, but so reflecting on this long lineage of white scholars writing about Black infant mortality that presumed a politics of knowledge that situates them as kind of objective outside observers, innocent observers, that then diagnose these deviant or damaged objects of analysis in Black infancy and always also with Black maternity, and Black community pathologies that they ascribe. And so what I really came to was that I needed to reverse this diagnostic lens and really turn it on the analyses, the political mechanisms of denial and deflection within that lineage, and then also how they enter into kind of dominant white common sense, about, who are worthy infants worthy of saving, and who are not, and in increasingly subtle ways. And yet I argue that there are really important through lines in these analyses. And I'm drawing, on Dorothy Roberts, the legendary legal scholar who really, highlights this duality between, allegedly, according to white analysts, kind of damaged Black communities. And there's a whole lineage, of Black feminist scholars writing about things like the Moynihan Report, which, characterized the Black family as a site of, like, again, pathology and degeneracy. And that those deflections, so kind of like drawing on that work, it became clear. So the title of the book is Fatal Denial, and that these deflections by white experts then serve to perpetuate the actual material conditions that endanger Black infant survival. Yeah.
Yeah, well, thank you for that answer because it sets up a couple of the things I wanted to talk to you about. And the first one is this idea Baldwin had, and it's very close to what I think you probably described it very succinctly in your answer just now. But can you tell us what this idea of racial innocence is and how it perpetuates what you were talking about? This idea that white people are outside, judging and defining in many ways, diagnosing the Black experience. So can you explain how it's a linchpin in your research here?
Yeah, absolutely. And I think that Susan Reverby and Evelyn Hammonds, actually, they also write about Frederick Hoffman and kind of like the science wars between Frederick Hoffman and W.E.B. Du Bois, with Frederick Hoffman, this white, and in fact, he's born in Germany, and Khalil Gibran Muhammad makes this point that he actually situates himself as an objective observer precisely because he's not from the United States. Although, most of the United States experts and physicians, white experts and physicians, were also positing that kind of, objective authority. But uh um he really okay, so Reverby and Hammonds, they talk about how there's this, like, he posited these inherent traits within Black folks, and he actually explicitly is drawing on, eugenic literatures or kind of proto-eugenic literatures that were prevalent at the time, that were really explicitly positing that, the white Anglo-Saxon property, mostly like family form, individuals and family form, they had particular kinds of physical and also emotional characteristics that manifested their civilizational superiority. And one of those was, uh, um, the kind of um, almost divine complementarity of white men and women to each other, and then also the affection that they bore to one another, and then that was then transmitted as a feature of white, the kind of superior white racial stock that they wanted to cultivate. And, as I also note, like early organizations that were set up for the prevention of infant mortality, white infant mortality, even as there was some complexity in like what national and ethnic groups were considered white or considered to like be worthy of kind of embodying the national future. They were really explicit about like these white baby, about supporting, the reproduction of the right kind of white babies. And so there was just a real, and then Du Bois is coming in and saying, no, it's all about environment. So Hoffman, these inherent, degenerate traits that are being reproduced and kind of weakening Black folks, Black communities over the generations. And this also rested on the really atrocious notion that in fact Black people had been protected under enslavement. John Calhoun, made this political argument in the mid 19th century. So it was, and then it kind of pervaded science as well. And so they really weren't able, the idea is that like Black folks were not able to survive on their own. As we can maybe talk about later, Du Bois pokes all kinds of holes in Hoffman's argument. But Reverby and Hammonds talk about how the Hoffman Du Bois debate is kind of paradigmatic because it in fact characterizes a whole continuum up to the present day of, on the one hand, this white attribution of an inherent pathology within Black people, or at least within Black culture and communities. In Hoffman's time, he was explicitly talking about how, the other side of the coin, like how virtuous and evolved the white people were, at least the right kind of white people, Western European descended white folks. And so that assuredness in his own, like the superiority of his own kind of racial group, um, kind of emanated this kind of I always think about it as like somebody like almost up in like an aviation tower who's just able to kind of have, or what Donna Haraway calls a God's eye view, or what M. Murphy talks about as seeing human groupings, like the notion of population, which it has already emerged, but kind of with the real like anchoring of white supremacist political regime in statistics that were supposedly objective, and I want to say Khalil Gibran Muhammad really talks about like the statistical truths of race really taking shape in the 1890s, especially through Hoffman's text. But this notion of, yeah, being able to judge from above, and there's an implicit, well, explicit for Hoffman, and then implicit as the decades go on, presumption that the observer really embodies that objectivity through being part of this civilizationally superior kind of culture, and but also embodiment. And I think we can get into, how some of these um how there's such a resurgence, I think, of the more explicit self-ascriptions of superiority on the part of maybe less white experts right now, but on a societal level. Yeah. And so, okay, I didn't even get into Baldwin though. I'm sorry. So racial innocence. I mean, so Baldwin wants to, My Dungeon Shook, a letter to my nephew on the occasion of the 100th. Um, I'm getting the title wrong, but it was the 100th anniversary of the Emancipation. And, it's one of Baldwin's most famous people. And sorry, not people, one of Baldwin's most famous pieces that he wrote. And he really, I think one thing that I keyed into revisiting, because I'd read it many times, I read it as an undergraduate and, it blew my mind. But coming back to it within this frame of thinking about Black infant mortality as in some ways a function of these deflections and thereby the perpetuation of the material conditions, he talks about his nephew's birth like again and again, that he was there when he was born and that whites had created the conditions in which, the nephew to kind of quote Audre Lorde, also never meant to survive, and that they do not know it and they do not want to know it, and yet, of course, we as white people do know it. And yet, there are these, there's this whole apparatus of mechanisms that explain away the agency, that whites collectively, have to build the environment in ways that segregate our view from the realities that have arisen from our theft and hoarding, and never redressing or reckoning with the legacies of enslavement. So Baldwin is this kind of really just offers a brilliant account of how, and the political theorist Laurie Balfour talks about how he is a real spatial kind of geographical thinker. So like literally, he talks about Harlem as a place where whites never have to reckon with the harms that they're just everyday, like the everyday conditions of their being and reproduction of households and such, is really kind of parasitic on, right? Ruha Benjamin says, vampirically, white vitality feeds on Black demise, and so I think that Baldwin's notion of innocence, and the last thing that I'll say is that for Baldwin, he really just powerfully um like depicts this that kind of vampiric or you know the way that white life is predicated on, or white material advantage is predicated on this like constant, assault on Black life and theft from what should be supporting Black life. And white innocence is also killing white people. And so that's the other piece of this is that, even as, whites are, you know, materially insulated relative to Black communities. And it's also important to always link that to the ways that white settlers have, their existence also depends on the theft and attempted genocide and ongoing occupation of indigenous lands, and that those lands, that theft had to happen for slavery to happen, and they're just so inextricable. But that also, the same forces, like that paradigm of theft and disposability, also structures white life, although in very different ways. And so those same forces of, extraction and toxic exposures that whites have been so willing to subject Black and Indigenous and immigrant of color communities to, it is also what is killing the planet, and it is also eventually endangering white life. And I think we see that in the fact that even white infants in the United States, if you look at a kind of global and I do talk about how statistics are a tricky and problematic way of measuring health and thriving. But as a kind of uh, like as a schematic, right? To kind of just put things into comparison, we know that white babies don't actually have optimal survival rates at all on a global scale. And we can see the ways that kind of institutionalized neglect and our just standard obstetrical protocols really don't treat birthing people and their babies well across the board. Although, of course, not to conflate what Black pregnant and birthing people experience with white pregnant and birthing people, but the Birthplace Lab, which Monica McLemore and Saraswati Vedam and others have done a lot of research on treatment of obstetrical patients. 1 out of 6 women, the research is on cisgender women, 1 out of 6 women across the board report obstetrical abuse during their birth process, which is outrageous. It's completely outrageous. And so these harms pervade, although their impacts, like the scale and intensity, and kind of the nakedness of the brutality is, of course, very different for Black and white and Indigenous and Latina and other folks, in across different geographies.
Right. And I think one of the things that struck me when you were talking about Baldwin and Hoffman is that there's this, and it starts way back in slavery and even before that colonial project, but there's an inherent contradiction, there's an inherent hypocrisy. And then that is very difficult to fight against because no matter what you posit against it, it always comes back to, it's always rewritten in a way, it's always erasured. There's a moment of erasure that,
Yeah.
well, we didn't mean that, we actually meant this. And I think as an example of that,
Mm.
talk about how the innate, like Black, Hoffman's idea of extinction of the Black race turns into blaming Black mothers for babies.
Yeah.
And there's that shift between, like, if it's not innate in the actual race, then what is it? And
Right.
personal responsibility, it's on and on. You see where
Exactly. Exactly. Yeah, exactly. And then that really turns to the culpability of Black midwives as well. As so it's like, and in some ways, there's this disappearance hypothesis, of that I talked about earlier that Hoffman is propounding. And I want to say it's not just Hoffman, like this is pervasive in all the medical journals. I mean, it is the conventional wisdom. I honestly, have even a hard time wrapping my head around it, but that was like, oh, and I want like one thing that was really in my face as I was looking at these documents from old medical journals from the late 19th, early 20th century, was that it, talk about that innocence and the supposed objectivity. There was no, even as there were, it was the progressive era, so people were really galvanized around improving white infant mortality rates. And there was an almost uh, like casually sadistic tenor to the ways that that they talked about Black infant mortality, and it was like, well, is it worth it? If the race is disappearing, like intervention really isn't called for. And I do want to say it's really important to note, and the historian Wangi Muigai is really key here, that, Black communities were forming mutual aid societies, and Hammonds and Reverby talk about this too. The Black club women were creating programs for, newly arrived mothers in cities, and really just trying to create spaces of refuge. Black physicians and nurses were really engaged in this life-saving work. So I don't want to, it certainly, like, white expertise and like kind of just refusal of intervention was not the whole story. And that's really key. So there's always been, a broad array, which I, am not, I feel like I only scratch the surface. There are scholars who have written more, have really, really attended to this. And for instance, Lakeisha Simmons, situates current Black infant and maternal outcomes today in the narrations of WPA interviews, of formerly enslaved people who talk about Black maternal and infant, and really, the casual violence. But also, and Sasha Turner is another scholar who's really, like, just attended and so closely to what is largely missing from the archive, which is the experiences of loss, of enslaved mothers, experiences of loss in this, really hellscape of reproductive life, where, not only were enslaved Black infants, far more likely to die because of the terrible conditions, but also were already, as property, already lost to their mothers as kin, right? That kinlessness that Hortense Spillers talks about, and the ways that materialized. And Turner also, I think, really importantly, um, centers the unknowability of those experiences, while also, listening to the fragments that are there. But I'm sorry, I feel like I went off track a little bit there. But okay, so right, so white expertise not being the whole story, right? And then disappearance doesn't happen, as Du Bois writes, even back in the 1890s, like, this is actually wrong too. Like, we can see that, in fact, Hoffman is drawing, like, I mean, I highly recommend Du Bois's review of Hoffman's text. It's so good. It's so arch, and and also just, like, uses data in such a skillful way. And he's like, this is actually just false, what Hoffman is claiming. And compares it to, does some of the first international comparative statistical work as well to talk about, the actual story. And so, as the disappearance hypothesis loses purchase, then there's a turn to cultural pathology. And by the 1920s, and this is already happening in the 19 teens, it really is the becomes the fault of Black midwives and mothers still, of course. Like, it's always, like, bad parenting, neglectful and apathetic parenting by Black mothers in particular, although, fathers and the whole community's, doing it, is causing the harm, according to these experts. But yeah, it becomes about, like, their practices, and their, like, bad beliefs. And then they're kind of the midwives become this kind of threatening figure that is doing all kinds of harmful things, even though their outcomes, if you look at that, I mean, it's really wild how some of these experts and they actually look at the statistics and then they say the opposite. That in fact they're like midwives were actually the births that they were attending were often surpassed, in terms of outcomes, the physician attended births, and then they just interpret it the opposite way, but Black midwives, and so I have a chapter on Black midwives in the Jim Crow South, and that becomes so as so there's a kind of across the board anti-midwife campaign, but whereas for white or becoming white groups in especially in the Northeast and Midwest, Italian and Irish and Eastern European Jewish communities, were kind of cajoled into leaving their midwives, behind as anachronistic. And don't get me wrong, like the rhetoric and imagery that experts were using against midwives in those communities was really like terribly, terribly devaluing and really yeah, just characterized them, brought in all kinds of ableist and like civilizationist kinds of language and painted them in super ugly terms. But they did have alternatives. They were eligible for medical care, and unlike in the South, where white physicians would not treat Black families, and even in emergencies. And I'm painting with a broad brush, but that was the general situation. Medicine was entirely segregated. And so in the cities, there were, Black physicians and nurses. In the rural areas where most Black folks were living, though, midwives were primary caregivers across the lifespan. And but Southern health officials, especially after the 1921 Shepard-Towner Act, which was this first, actual like federal health funding, and particularly reproductive health funding program ever, and was, pushed along by women's suffrage, problematic and incomplete as that was. And so it offered funding to states to improve maternal and infant health. And that took a really different shape in the Northeast and Midwest versus in the South, where it was largely used for these midwife control and training programs, but which really entailed, so they were both conscripted into this regime of kind of pseudo intervention that white states were enacting, or sorry, that Southern segregated states were enacting as a kind of nominal intervention to improve Black infant and maternal infant, Black infant and maternal outcomes. But they both put the onus on Black midwives as a kind of scapegoats, but then they also conscripted them into this regime of state surveillance. And that entailed criminalizing a lot of the vernacular practices that they had carried forward, for centuries. And that's not to fix it in time. Obviously, there were always changes and shifts in understanding and applications of science, but that they yeah, but herbs were rendered, illegal. Midwives, after the 1924, Racial Integrity Act in Virginia, and then the ways that spread throughout Southern states, and eventually the whole nation, uh, was in different ways. Well, so throughout many states, that they had to report if the baby was the product of an interracial relationship, right? So they were both conscripted and scapegoated, in really complex and largely nefarious ways, although it's also important to note that within these, really harsh strictures, Black midwives continue to provide really crucial life-saving care. And in some cases, there was a Black physician, Ionia Whipper, who actually worked with Black midwives um, I, in different parts of the South. I think she was associated with Tuskegee, I think. So Wangi Muigai writes about her. And so some of these, there was sort of there was complexity in how efficacious some of these training programs were, and sometimes the tools for hygiene, et cetera, and supplies, they were able to use them. But yeah, at the same time, it was this also way to surveil and then eventually do away with Black midwives was the kind of long view. But it was like uh there was a contradiction built into that because there wasn't a kind of, cadre of white physicians in the wings waiting to take care of these families. So that always remained an open question, like who's going to then attend these births if the plan is to phase out Black midwives. So
Well, and we've seen an uptick recently in the last maybe 10 years or so of midwife kind of coming back into
yeah,
the foray of birth and doulas as well. And that, there's quite a big contingent of people of color who are doing that here in Cleveland. Let's
yeah,
talk about kind of jumping ahead a couple decades to where we are today in the last 25 years or so with the
yeah.
push to kind of recodify some of the advances that have been made as not advances at all, but somehow seen as, I mean, I don't want to say, but they're looking at the advances that were made and said
Mm,
these are failures because of the people who did them. And so health campaigns now, when they target minority groups, it's all about personal responsibility. It's all about
mm,
what you can do. And it once again is denying, it's establishing that racial innocence, that there's
mm.
a system in medicine and healthcare that is biased and has disparate outcomes and treatment.
Yeah.
You talk
Yeah. So there I think it's been a really like kind of it's a real shifting landscape, and I think there in an accelerated way, like um there's been a lot of change. I think especially in the last like 10 or 12 years, and then also though, kind of sneaky continuities. And I want to make sure to talk about the cult of true babyhood and kind of how that's resurging. If I hope we have time for that. But so on this question, so in the 2000s, there was a kind of a real surge in journalistic and and I want to say even in the 1990s, so I'm thinking about Leith Mulling's Harlem Birth Project, did absolutely groundbreaking work to, Leith Mullings was a medical anthropologist, but worked with a team in Harlem to really do deep qualitative research with mothers there around the conditions of their lives. And Mullings was just so kind of brilliantly articulated the ways that these mothers both, were experiencing pregnancy in an extremely economically, because this is really like neoliberal disinvestment, was, and also, the attacks and then like end of welfare as we knew it under Clinton, attacks on social services that was happening in the 80s and 90s. And then, with globalization and deindustrialization, like how these things were impacting um Black communities, and Harlem was the focus, and really just positioned, or attended to Black mothers as really at the crux of these forces, as they are, their bodies are doing the work of, you know, um, creating new human beings. And they were subject at this local level to all of these broader forces, broader nation and world shifting forces, economic, under continued white supremacy, and patriarchy, and so the ways that even like labor market sexism impacted, as well as class inequality and racial inequality, how all of those were coming together, as well as community mutual support and resilience played into the ways that of these experiences and outcomes. And so Mullings coined the notion of the sojourner syndrome, which was, really about how these stresses um, and forces were bearing upon Black women, and just how much they were tasked with, right? And what kind of wear and tear that was enacting on their bodies, even as they were also, really creating also community conditions that offered some, support in the face of all of these forces that were just asking them to do too much labor in every way, And so Mullings was tracking these things even back in the 90s. Okay, and then in the 2000s, from the medical, and they were not citing Mullings for the most part, as far as I've found. I don't want to like rule out that possibility, but there was this paradigm of the life course. And so there were also, stress becomes a key word. And there is a real, and also Nancy Krieger's kind of social ecological model. So there's this kind of brewing, there's some parallel streams of really taking seriously, racism, classism, sexism as environmental conditions that are really determinative, and that push back against the notion, these kind of behavioral models for understanding, maternal and infant outcomes. And so over the course of the first decade of the 21st century, there was also a tension. So, and I think there's, kind of complex relationships between all of these, a surge of attention to Black infant mortality. And it often, the journalistic coverage, as you were saying, often, it was like so Hakima Tafunzi Payne, who is a leading Black doula in Kansas City, and Sherry White, who's another doula, I think coined this, and then Hakima Tafunzi Payne popularized it, or of disparities pimping. So there was a real like focus in both the scholarly, health sciences literature and in journalism on these disparate um, uh, infant mortality rates. But again, as you were saying, the intervention. So even as there was more attention in the research to environmental conditions, including racism as a key environmental condition, and their impacts, the way that the intervention would take shape would it would still refer back to the mother, and things that she needed to de-stress, right? That's like one of the most gross ones, that even in this campaign by the Office of Minority Health that was started in 2007, there's this recognition of stress as a factor, but it's like, oh, do yoga, think pleasant thoughts. So it's like an incomplete encounter, and it's yet again another deflection and declaration of innocence. And but since then, um, there has been, and I do, it's definitely in part, it's been because of the birth justice movement, the reproductive justice movement, which really is a human rights framing of the right to have children, not have children, raise children in safe and healthy environments. And that includes environments free of racism, police violence, mass incarceration, environmental violence, so really a capacious notion of environment, um, and demands, by birth workers, as you were noting, Black midwives and doulas have really been at the forefront, and physicians as well, like some really key Black physicians, and advocates have really shifted the discourse. And so I would say, and I also think the Black Lives Matter movement, and from 2014 onward, and the focus on police violence, toward Black children in particular, really coming to, I think also helped this come into focus. And so there is a shift to recognizing racism as a key factor, um, and so and at the same time, along in kind of the same time period, so I want to say, midwives like Jenny Joseph, who is the founded the first Black-owned midwifery school. She's an incredible midwife, had been saying and practicing this kind of, uh, the creation of safe care sites, for all birthing people, and showing that in fact outcomes, there could be parity in outcomes given this kind of care that really respects the dignity of the whole person, that does not block access to care according to insurance status or immigration status. And so, and also the Birthing Project USA, which started, decades before this was coming out in the literature. Catherine Hall Trujillo was the founder of that. And so, just the notion that support, especially community-based support, so doulas or people who are accompanying the pregnant and birthing person through their process and through the postpartum is important too. We have, like, across the board such a terrible lack of postpartum care in this country as a standard. And they'd been showing, that this really made a difference. And then, but so yeah, so in the like 2014, 2015, there's a real shift in discourse to acknowledging racism as a key factor. And this is evident in documents like, well, the Black Maternal Momnibus Act. So it's coming out in really key, national level, congressional hearings and things like that, they're really, and Black mothers are testifying about their near misses or losses in really, really important ways. And Jenny Joseph and other Black midwives like Carmen Mojica are testifying before Congress, and many, many others. I don't, but Jenny Joseph is named a Person of the Year in 2022 by Time, and so there really is a shift to, looking to what Donna Iene Davis calls obstetric racism, right? So not only the kind of the broader structural factors, which of course are, impinging on Black maternal health over the course of the lifespan, but also the harms that in fact that that the medical encounter can entail, and the ways that, Donna Ian Davis's notion of obstetric racism really breaks it down and talks about, the dismissal of Black women's own, what they say about their own experience, like, hey, this doesn't feel right, and we have some celebrity cases that really bring that into focus, like Serena Williams near miss. And so on one hand, there is this real difference from like that, Office of Minority Health campaign in 2007 to 2012 or whatever, that's like, oh, it's individual, you need to just like take better care of yourself, to a real indictment of both, broader societal racism and obstetric racism. Um, and what has then happened in the face of that is there has been this, and I think, Black doulas do incredible transformational work, really, insulating Black birthing people from the kind of most frontal forms of obstetric racism, and advocating and supporting their advocacy, um, self-advocacy by Black birthing people. But there's also been, in some ways, and Jennifer Nash makes this point as well, and others have also, that kind of looking to Black doulas in particular as a kind of silver bullet, in a way that then again deflects from institutions having to change their own protocols of racism, and so what really needs deep transformation, yes, support Black doulas, fund Black doulas, right? Because they're often, this long history of extracting labor from Black women, then persists in not, paying a living wage to Black doulas. And I'm thinking in particular about, state level programs that do pay doulas, and Black doulas in particular have been at the forefront of this. And I want to like also lift up, Tewa Women United has an incredible, Native doula program, and or their, nation specific doula program, and also the incredible work that Black midwives had done. But yeah, just kind of looking to Black doulas as the solution, and therefore, deflecting from the need to change. So it's been a bit of a double-edged sword. And now with the attacks on just naming racism, it's unclear, how that's going to impact. And I think, 2020 was a real galvanizing or like pivotal point at which, there are all these mea culpas by, every hospital, every health organization, saying, we want to redress our history of racism. And yeah, it's unclear kind of what's going to happen to that. And, there was, I think, quite a bit of due skepticism from birth justice advocates about how the rubber was really going to hit the road, in the wake of these statements. And that's not to say that the statements weren't important, and the kind of work to get there on the part of these associations hasn't been real to some extent, but it really, like, that the inertia of racial innocence on the part of both, practitioners, but institutions, medical schools and hospitals themselves, there's a lot of inertia. And, we see, for instance, and Grace Howard writes about this, the continued over-testing of Black women for drugs, Black mothers, and in ways that construe them as problems, white mothers as innocent and their babies as innocent, and which actually can then miss situations that need care, not policing, but that need care among white mothers. And I want to say there are, in many southern states, in the context of the opioid crisis, many poor white mothers are also criminalized under this, like, generalized, like, we shouldn't be policing and criminalizing pregnant and birthing people, any mothers, any birthing parents, period. But yeah, we still see these patterns emerging. And so, as Hoffman was doing, these standards of white innocence, which then become institutional. So it's not even necessarily white physicians and nurses that are perpetuating them, although the heaviest onus and kind of I lies on white physicians and practitioners, because it's so easy to situate oneself as innocent, but these institutional standards are carried out, across hospital staff oftentimes, and then, the other side of the coin, it can make such a difference to have an attentive, especially culturally congruent, but just an attentive, you know, um, labor nurse, who refuses to drug test or won't call the cops, and it's important to lift up those folks who are working against the grain as well. But yeah, like Black doulas and indigenous doulas, like, fund them richly, and also, that myth of innocence needs to be not only dispelled, but materially rejected, and, responsibility taken for transforming these harmful protocols by institutions themselves.
And I want to give you a chance to talk about the reemergence of true babyhood. And one of the things that the AP reported over the weekend, that the Transportation Secretary, Sean Duffy, is telling the department to fund areas that are
Yeah,
birth rate, high marriage rate, nuclear family, which is mainly red states at this.
right.
But it seems to me that that kind of rhetoric immediately ties itself into what you define as true babyhood and who we want to be birthed into our society, who we want to see succeed. And this idea, I guess it also comes into the white replacement racism and that. So if you want to end on.
Yeah, absolutely. Is it okay if I read a little bit? Just a little? Um, so um So I'm drawing on the just absolutely, pivotal work of Hazel Carby, um, uh, in her work, in from the 1980s, who talks about the reconstruction of womanhood, and she talks about, she kind of takes on white feminist critiques of the cult of true womanhood, what they called the cult of true womanhood, and really talks about how this ideological figuration can't be understood without the corresponding ideological figuration of Black women as kind of non-women, according to, the chastity, piety, and domesticity that, that the cult of true womanhood ascribed to propertied white women, right? And so she shows how this really functioned, to maintain, the legal, cultural, societal system of domination that enabled enslavement, and then, of course, has continued to impact arrangements of power and life in the U.S. to the present. And so she talks about the cult of true womanhood as a inherently racial as well as gender formation. And so I build on her account to posit that there was a corresponding cult of true babyhood, which is the iconization of a typically abled white cherub in devoted maternal embrace at the heart of propertied heteronuclear domesticity. And if you look at women's magazines from the 19th century, this is an image that's repeated, that's maybe at the heart of that, of those depictions. The true baby sits at the apex of health officials' disavowed hierarchy of life worth. Now, it was explicitly avowed at the time in the 19th century, but even now, the true baby is the norm, in reference to which medical discourse and education and popular media alike cast Black infancy as deviation or damage. And the true baby has marked a core incommensurability among human groupings since the mid-19th century, the ultimate avatar of white settler reproductive futurity and the unacknowledged operative standard in the comparative, what I call biopolitics, but kind of like approaches to care and survival. Um, uh, and of infant mortality, both alibi and embodiment of racial innocence, right? So it's like, what could be more innocent and what is more in need of protection than this white and typically abled, baby? The true baby is the sanctified idealization of a white supremacist property regime that is, in fact, predatory upon Black life, health, and labor, predicated on the genocide and dispossession of indigenous lives, relations, and lands, that devalues and invisibilizes feminized care work, because it's naturalized, right? It's just like, this kind of holy, mother and infant, Madonna and child kind of iconography that seeks to dispose of disabled lives and wreaks disaster through US militarism and extractive capitalism worldwide. I mean, it really is this kind of blinding figure, that is the, ultimate innocent, the image of kind of ultimate innocence and kind of unimpeachable innocence for which any sacrifice can and should be made of other people's lives, right? And it's, the anti-abortion campaign and kind of the original criminalization of abortion in the US is part, true babyhood is also the kind of like motor of that as well, because these physicians were really talking about, in terms that are really distressingly resonant today, talking about what we now call the great replacement theory. They're being out, other groups, Catholics, Irish, Italian, and of course, Black folks, and Chinese, right? There's also an anti-Chinese dimension to this white baby. Like, and so it's about the loins of the white women, really doing their duty to populate the nation, and the white baby as this like sacred embodiment of the national future. And because that kind of that unimpeachable innocence, as the kind of explicit or implicit uh um like cause or imperative of saving, infant life, that has it's been a kind of magnet for the ways that these racially differential, or the kind of, magnet's not the right word, but it's been it's just it has been the kind of encompassing logic, maybe, of infant mortality interventions across time. So whether that's, abortion to prevent loss of infant life, even though, of course, an early pregnancy is not an infant, from the 1850s till now. And that's still, we see that in anti-abortion rhetoric now. And then, I just think about the 14 words of this fascist slogan, and I'm not going to get it right, but we need to ensure the existence of our people and secure a future for white children. So I know those are the last words. And so it really, if you think about like RFK's, immunization and the anti-vax movement, it really is all about like the purity of these white children who should not be, exposed to, what the anti-vax movement thinks of as kind of contaminants, that they don't need, because they are themselves these pure vessels that couldn't possibly be vectors of disease like those other babies over there, And so I feel like, and then yes, like Duffy's, declared intention to, foster better like infrastructure, among spaces where, at least implicitly, the true baby is getting, there's the most true babies, I guess, I think really shows this through line of, the true babyhood as and it's interesting because there's like in queer theory like Lee Edelman's No Future is in some ways about the rejection of the true baby, but he doesn't name the whiteness of it, and so it's really about a particular kind of reproduction of this heteronuclear patriarchal domestic household. And I think we can see this, in the resurgence of like, I don't know if it's a resurgence, but like the popularity of, the trad wife, or, reclaiming a kind of traditionalist, almost as if it's a feminist move, although they decry feminism for its harms to particularly, specifically to that configuration. But it's like this a proud avowal of that heteronuclear household that will produce this perfect innocent infant. And so I think it's throughout it. I feel like the true baby is this kind of like specter that is rationalizing and also and justifying, in some ways, like the current of fascism, anti-immigrant deportations, mass state violence toward particularly poor Black communities, um, environmental racism that we know causes, birth defects and cancer in children, but it's this open secret, like the protecting the true baby, has really been this imperative over time. And now we're just seeing it, made explicit again.
Right, and a lot of that comes back to the DEI argument of the right, which says that the only reason white males aren't in positions of power, and we see people of color and women, is because they were passed over. So
Right.
there's this idea of patriarchy as well, that the white male baby is,
Yeah. Yeah.
is the potential for the nation, and it's everything is
Yeah.
embodied in that pure white male.
Absolutely. I mean, I think you're absolutely right. There's an identification with the white baby, the kind of white man as white, like both past and future white baby, and that and I think in some ways that can explain what what they characterize as an existential threat, kind of like is rooted in this, kind of the preciousness and the bearer of national destiny of the white baby. And it's like, and I think in anti-abortion discourse, that's where that identification is particularly flagrant, I am that white baby, or that white baby was me, and so, but yeah, absolutely.